I'm John Geaver with MedPage Today in Washington County, Pennsylvania, in the southwest corner of the state. It's one of the hotbeds of drilling for natural gas in what's known as the Marcellus Shale formation. Recent technology has made it possible to drill for gas more than a mile underground and with wells that actually travel horizontally underground. The impact on the region has been quite substantial, and many people are claiming that they've had health problems as a result of the drilling, not only because of the fluids that are used in the so-called fracking process, but air pollution and noise and even psychological stress. There was a conference at the University of Pittsburgh recently that looked into the health impacts of natural gas drilling in this region, sponsored by the Graduate School of Public Health. I talked with one of the organizers of the conference, Dr. Aaron Barchowski, in the Graduate School of Public Health.
I think the real take-home message is that we don't know the full health impacts of the various constituents that might be contaminating the patient's environment. There are, a lot of concerns about what's going down in the well during the fracking process, but many of those chemicals may not come up. That's not to say that there aren't industrial spills, etc., that may cause concerns from chemicals. You heard from the occupational talk that there were a lot of health concerns with workers who were just being exposed with their skin or breathing in too much chemical. Again, an occupational dose of the chemical, and there were just physical burns and things. But he also said that they've seen a lot fewer of those as the industry's gone to best practices. I think there is a lot of concern with drinking water quality and whether it's making drinking water quality better or worse. That's not completely clear, or where it is. There was a talk that indicated that there may be an increase in methane in the water, but even if it's a low level of methane, you can say that it's an indicator of chemicals coming in, probably through bad casings, into the groundwater and causing contamination. So there could be a lot of just physical irritants symptoms if exposures are high enough, or there may be long-term changes from some of those other constituents in drinking water.
These are concerns in the Marcellus region because wells may be drilled within 100 yards of people's homes, but finding out whether contamination is actually occurring will be difficult. I wondered whether it's maybe too late because so many gas wells are already in place.
I don't think it's too late because obviously the exposures really haven't kicked in. I think you heard a couple talks where they said that one well here, or one well there, or one well over there is not really the major concern. It's when we really ramp up to a lot more wells in densely packed areas that then we have air toxic exposures as well as possible water toxic exposures. So I think the best thing that could be done is that we actually, and the physicians can help with this, is to actually track the health of folks in the areas where the drilling is starting to occur, and are there any changes in health. Obviously there are going to be a lot of folks who say, oh, drilling just happened and I just got this disease, so it's an association, but it's not always true. And as you say, we really do need the large epidemiological studies to show us, what are the real health risks and what we should expect.
At the moment, however, those studies are only in the proposal stage. In Washington County, Pennsylvania, I'm John Geaver, MedPage Today.